Financing and Reimbursement Methods by Professor Tammy.
Financing and Reimbursement Methods Part 2. Private Insurance. Distribution of health plan enrollments. There are 5 main types of private insurance that are available. They are group insurance, self-insurance, individual private insurance, especially for those who are self-employed, managed care plans, and high deductible health plans, which is also known as HDHPs. So when you look at figure 6.2, the distribution of health plan enrollments, page 132 in your text, you'll see that the high deductible health plans tend to have increased over the 11 years. In 2006, it was about 4%. Managed care was 93%, and conventional was 3%. 2007, managed care was 72%, HDHP was 28%, and conventional was less than 1%. Employment-based health insurance rates vary by employer characteristics. So, let's just say that you have health insurance A, and your friend works in a different place and also has health insurance A. And you're like, why is your co-payment and deductible so different from mine? Well, each plan is different even if it is the same health insurance, because it's based on the negotiation of your employer and the health insurance. See Exhibit 6.2. Employer characteristics that influence health insurance offer rates, which is on page 133. Large employers versus small employers. So if you have more people that are working for you, you can negotiate better, saying, hey, overall, I'll be paying you more, so I want a discount. Number of high wage earners versus low wage earners. You might have more people who earn higher payments versus lower payments. It depends on what type of company it is. Full-time workers versus part-time workers. In some places, if you're part-time, your health insurance may not be as good as someone who is full-time. Or even, let's go back, high-wage workers versus low-wage workers. Sometimes the manager might have better health insurance. Percentage of young workers versus older workers. If you have more younger workers, most likely they're not going to the doctor as often as older workers, so you can negotiate that into your group. 5 main types. So we will see in the next slides. Group insurance, self-insurance, individual private insurance, managed care plans, and high deductible health plans, also known as HDHP. Types of private insurance. Group insurance. They are offered through an employer or a union or a professional organization, such as your employer could be the health department, your union could be D37, and your professional organization could be the nurses organization. Anticipates large numbers of people in a group will buy insurance through a sponsor. So they expect a lot of people will join into this group. Costs and risks are shared among the insured. Self-insurance. Large employers' workforces are large and diversified enough. They can predict their own medical experience. They can assume risks and pay all claims. High losses are covered through reinsurance. Individual private health insurance. For those who do not have group coverage, such as farmers, early retirees, or the self-employed, those who work for themselves, the risk is individually determined based on person to person. This market grew by 5.3 million in 2014, but the effects of the ACA are unclear. Managed care plans. Managed care organization, the MCO, consists of Health Maintenance Organization, HMO, Preferred Provider Organization, PPO. Managed care plans assume the risk in exchange for an insurance premium. They assume the responsibility for obtaining health care services by contracting with providers. High deductible health plans, HDHPs. HDHP/HRA, which is Health Reimbursement Arrangement. HDHP is combined with Health Reimbursement Arrangement. It includes an employer finance account, tax-exempt payments made for qualified medical expenses. HDHP/HAS Health Savings Account. HDHP is combined with a health savings account, mainly employee finance on a tax-deductible basis. The ACA, remember the American Care Act, and private insurance. The ACA has several mandates, meaning a lot of requirements and have-to-dos. All U.S. residents must have health insurance that offer minimum essential coverage. Not having insurance, especially health insurance, incurs tax penalties. That means you're going to get fined. Effectively repealed by the Tax Cuts and Jobs Act of 2017. Health insurance can be purchased through government-run exchanges with subsidies for low-income people. ACA mandates, that means what they need to do, exchanges offer 4 categories of plans. Employers must offer insurance to those working 30 hours or more per week. Coverage cannot be denied for pre-existing medical conditions. Children and adults can be covered under their parents' plan until age 26.
See you soon. And remember to read the book.